Hi everyone, thank you so much for your time. As Rebecca said here, I'm Rebecca and Fiona said, my name is Guido Giunti, I'm a medical doctor, I'm a GP, and I'm here to tell you a bit more about the overall work and efforts that we had in terms of designing a digital health solution. This is part of a large effort that is multidisciplinary that started with the University of Oulu and my team over there, and then we were lucky and fortunate enough that a lot of it got wrapped around and a lot more people got involved in different institutions across Europe. So just to give you a quick roundup, if we ask about what are digital health apps or apps for health, one of the things that is really interesting is that if we take a look at the screen here, it is a breakdown in general about what's likely the topic. So you will see that there's a fair chunk of these that are in well-being areas, and you will see that there's roughly only 10% of these apps are about a disease-specific condition. Now, what's really interesting about that is that this is actually from 2015, and the numbers are actually doubled or even close to tripled right now. But the proportion of disease-specific solutions is still more or less the same. Basically, a lot of the people who are working on these technologies, they try to stay kind of agnostic of a condition and try to work in the wellness aspect. So one of the things that we need to be thinking of when we're trying to do something for MS or for any condition is try to understand the challenges that are specific. And the idea is that we generally have this kind of vision of the innovators, all of these people who have this idea, these visions of what's going to happen. And what I'm trying to here is tell you a bit about what we did, and then I'm going to tell you a bit about what's the actual journey to get here. So one of the things that we did is we created this solution, which is called More Stamina. Basically, this is a gamified to-do list. It's we grabbed the concept of the spoons, the spoon theory, and all of the things, how much energy you have, but we converted it into stamina credits or energy credits. So like in any kind of video game type of thing, you have your life bar, which is your energy. You start to say that how many activities you want to do. For example, I want to go shopping, and I think this is going to take 20% of my energy, 25%, and so on. And you start having this list, and you get this kind of visual confirmation of how tired you're going to be by the end of that day. That's not much of a novelty in itself, it's more of a visual aid. But what we added, what ended up happening is we created this section where once you mark an activity as done, the system would prompt you to evaluate a posteriori, so after you've done the activity, well, basically, did it cost you that much energy or not? So what happens in the background is that we start making a trend and analysis for each activity. Okay, you said that shopping cost 20. You answer it was more than that. And we start creating a pattern for each specific condition or activity that you say, so that we can understand the trend of how good are you at predicting how tired you're going to be. And what we then do is we combine that with patient-reported outcomes and surveys that we can push to the patients. We combine that information with different personalized recommendations, and we aggregate that to understand. Because, for example, it's not the same for me to be very, very tired now when it's 20 Celsius, hopefully, I don't know, outside, or if it's raining, or if it's minus 20 or minus 15 or 45, and I've been working for many, many days or many, many hours. So the idea is that we use the information available in the phone, basically your activity tracking. We use GPS signaling to figure out what are the weather patterns, and we combine all of that so that we can understand what are the actual things that are influencing in your habits and your tiredness levels. So what happens after that is that, well, next time that you're trying to add an activity that was identified as something that you're not very good at estimating, it's going to prompt you to say, hey, you know what? Shopping usually takes you more than what you think. Maybe if you want to do this, you need to remove something else from your calendar for today. And the idea is that the whole process for this is something that we're very proud because it was very much person-centered and evidence-driven. And I'm going to tell you a bit about what does that mean. Is that basically every single step, and this is just a selection, but every single step of the requirement gathering, the discovery, idea generation, prototyping, testing, piloting, all of that has been led and created by the evidence. So basically, we didn't start saying we need to do this. It basically one thing that fed into another, and this is part of the journey. And how is that different from the typical journey of designing digital health solutions? Is because in general what happens is you have some population, and then there's an innovator who has an idea and then starts thinking, okay, this is going to become a product and I'm going to go and make it to the patients. Usually it requires involving some developers. And then we give it to the patients. But the problem is that once you gave it to the patients, you realize that you didn't account for the healthcare professional or the MDT team that is working around it, and your solution doesn't really account for what are the needs or how does this clash in the workflow of this team. But let's imagine that this innovator was very, very good and they designed a solution that actually accounted for that. The problem is that we don't work in a vacuum. We're healthcare professionals. There's rules, there's requirements for us to do these certain solutions. So we need to figure out how do we argue for our centers to adopt this technology. So this is a problem. And finally, usually only there, that's when we start to think, well, we need to maybe figure out some kind of a metric, some kind of RCT, something that we can do so they can prove that this thing works. And all of this without even accounting for the fact of what's the policy and the regulations that we're working here. Is this a viable model? Is this something that's going to be living off grants all the time? And what about the family members of this person? The person in itself is not going to be able to do anything if everyone around them are not included in part of this holistic view. So the way that we approached it when we're designing the solutions, we started with the patients, but we, of course, by definition, started to include this. And this is something that started about 8 years ago when I was still doing my PhD. And basically what happened was that we asked the question, okay, what do people with MS need that can be addressed by technology? So I took the hard chore of going to a clinic in Switzerland. It's just a horrible life that I had to endure. And basically I was living there for about a month and doing interviews, focus groups, kind of like an ethnograph approach. And basically people who were working with MS, with people with MS and persons with MS. And the question was very simple. Where do you think technology could help you? And almost every single time that we asked the question to people with MS, it was fatigue. I need something. Can you please help me with the energy? For everything else, I can go ahead and take my pill. I can do something. Give me something that helps me with my fatigue. And when we asked the healthcare professionals there, yeah, okay, basically we need something that would help people with MS understand that the effort that you're putting in is actually paying back. We're physiotherapy, we're doing all of this sports medicine, we're helping them do this, but they don't have a visual cue of what they're doing. So clearly there was here a need. And you will see at the bottom like the link to the citation for all the papers, and you can of course find this also on the website. But basically the idea is that, okay, fine, we capsulated all of this into trying to understand, okay, what would be the need of the persona, a model of a person with MS that would help us understand what are the needs, and we created these visualization elements that were used for internal, for the team to sort of keep ideating in this. Now, instead of us going and figuring out, let's go and create a solution, we actually went and asked, okay, are there any solutions that are available? So this actually led to the question of, let's do a systematic review of the literature, let's do a review of all of the apps that were available in the store, and at that time, there were only 25 apps available for people with MS. This is 2017. And most of them didn't really address the needs of people with MS that we had identified and what the literature actually said. Basically, there were things about, okay, well, if you want to learn more about your condition, you can use this, or if you're a healthcare professional, here's how you can do disease management for your patient, but not for you as a person with MS. So clearly, there was a need for a better idea or a different approach. So here what we started doing is we started working with a participatory design approach. And the idea is that we took the opportunity of going to different conferences, different events, nursing informatics, patient associations all around Europe, and actually hosted sessions for co-design. And the concept was using our personas that we had designed for people with MS and this list of problems that they had identified, let's co-create something together that people with MS would actually use that will help them with their fatigue. And that led to us to have an identified concept of, okay, there should be something that would be about keeping track of the energy. And then with our team, we started working with the behavioral scientists to figure out how could these different concepts could tie into behavioral theories so that it could actually bounce off each other and enhance the overall approach. And we ended up having this prototype or this concept of a solution that could be more stamina eventually. And only then did we involve a developing team, because only then we actually need to create a solution. And of course, we were lucky, we needed to apply for funding, all of that very nice things that you need to do. But we ended up creating a prototype, and while that was being done, what the next question was, okay, we know what the version for the person with MS needs to look like. What about for the MDT? How should it look like? What is something that me, as a healthcare professional that is going to be having to work with this patient, what do I need to see? So we started doing another circle of activities that we were showing the people, the professionals, we were showing the solution that we were creating, and we were asking them questions. We had this opportunity again in Switzerland, in Spain, and in Finland, where MS teams were basically working and trying to figure out, okay, these are the things that, what is your opinion of the thing that we develop for the patients, for the people with MS? Great, now let's start developing things that we can do so they can be the back end or admin side or professional side of this solution. And on that point of view, we started looking at the perspective of, okay, how can you bring this into your healthcare system? And the idea is that we need to be understanding that the jump from going to a prototype to an actual product, it's a much larger scale and a much more complex problem, because a prototype just needs to work. An actual product needs to have a whole pipeline and roadmap for development. So what we started to do is we started to apply health technology assessment as the thing. Basically what we did is we grabbed one of these technologies, one of these methods, frameworks for understanding how a technology should be used in a healthcare scenario, and we matched it to what we have at the moment. Okay, we're in red in all of these things. Clearly, this is just a prototype, but let's use all of these things that are in red as the things that we need to develop so that we can actually become a solution that would be ready for an institution. And all the while, we kept with this participatory design approach, basically because we were understanding the idea that, okay, we may have a solution for the people with MS, we may have a solution for the professionals who work with them, but I know, as I'm a general practitioner, and also someone with a bit of common sense, that if I am trying to lose weight, it's going to be very difficult if at home everyone's eating McDonald's. So if we have a person who's trying to manage their fatigue and their symptoms much better, it needs to involve the context, it needs to involve the friends and the family. So we started having these co-design sessions with family members of people with MS, so that we were saying, like, how would you like to support this person with this kind of technology, and started iterating on what would the version for the family member look like. And the idea is that because all of this involved with this very much PPI or patient involvement process, we even had people with MS as not only part of the strategic board on the decision of the project, but also we actually had team members who had MS. We hired experts who had MS so that they would be part of the design cycle and the whole process, so that we would keep involving them back and forth. Because we knew that, for example, if we were going to do a workshop, and the workshop for a let's call them healthy person, a healthy person would be 3 hours long, we knew that if we needed to adapt that for a person with MS, how would that be? We needed to make shorter breaks and different types of things. And the idea is that this whole thing led up to a pilot study that we conducted last year, where people with MS used the solution for 2 months in their homes. And it was very interesting because a lot of people were using it. This was not an RCT, it was just a longitudinal study following them. And one of the things that they actually started using the tool to educate their friends about how tired they were, or how important was it for them that now it was a way of talk. One person was talking about how talking to their kids, it was a lot easier to show and see how tired mommy is because of all of this. And it evolved in a kind of a conversational tool for communicating with the family. So the idea is that we're trying to look at all of these things as a journey, and it had an insane amount of media press because of the different approaches. But the most important was that the patients keep reaching out to people with MS, keep reaching out to us, can we use this? And this is only because of the participatory approach that we took of doing it with everyone involved. And that's kind of like the message here. So thank you for your time.